We always hear about sleep conditions like sleep apnea and insomnia, and it's really important to address these. But we don't really hear about the effects it can do to your teeth and your jaw. But you might be surprised how many effects will happen to your mouth area simply because of a sleep disorder. So today I'm going to go over 10 dental problems you can get from a sleep disorder. But I'm also going to go over some simple ways to actually prevent a lot of these dental problems. So make sure you stick around till the end. Number one is bruxism, or in other words, grinding or clenching your teeth. There is a clear link with sleep problems like sleep apnea, for example, and grinding your teeth. Now, it's not just sleep apnea, there are other sleep disorders as well that can contribute to this. But there are some instances that when you relieve someone's sleep apnea, like when you give someone a CPAP machine, and it ends up fixing their sleep apnea, that they stop grinding their teeth at night. And I know I mentioned there are other diseases that contribute to it, like insomnia will contribute to it, and also other diseases that contribute to a resistance in breathing at night, but not to the extent of sleep apnea, will also contribute to grinding your teeth. Basically what happens is when you have any sort of resistance with any anatomical limitation, whether you have a deviated septum or your tongue is too big or something, and it's not sleep apnea, but you still have some trouble breathing, then it can still cause you to grind your teeth. The way this works is first your breathing will increase, and then this will increase your heart rate, and in turn it will cause an RMMA, or rhythmic masticatory muscle activity. And the reason your body is doing this is because it is a natural response to help protect your airway or protect your breathing. What studies also show is 50% of the time, people with bruxism end up having a sleep issue associated with that. So I'd say that if you grind your teeth or your dentist tells you that you grind your teeth, definitely get a sleep study. Now, the second dental problem you can get is TMD, or myofascial pain. Sometimes we hear when people say that they have TMJ. Well, your TMJ is a joint in your jaw. It's called the temporomandibular joint. And this is basically a hinge that helps open and close your mouth. Well, when you're grinding your teeth all night long, this can contribute to jaw pain. Also, if your jaw is not in a correct position when you're sleeping, then this can also contribute to jaw pain, and you can wake up with this TMJ pain. A common treatment for this is getting a bite splint made by going to the dentist, and they'll look at your teeth and they see if you're grinding your teeth, then you can get basically this thick plastic made that sits over one arch, either your bottom teeth or your top teeth. That way, if you're ever grinding or clenching your teeth, it'll kind of deflect those forces so that first of all, you're not putting that much pressure on your teeth and you're actually protecting all your teeth, but also you're not putting as much stress on your joint and your muscles. And this can relieve a lot of pain for a lot of people. The third thing is malocclusion, or having crooked teeth. Now, this is one of those things that can contribute to TMJ pain and also contribute to you having bruxism, but also people with more narrow jaws tend to have more sleeping disorders. And the reason all comes back to our airway or our breathing again. You'll notice that a lot of dentistry and a lot of breathing and airway and therefore sleep are all connected. And that's why a lot of the things that I'm mentioning here are also all connected. Now, the thing is, when your jaw is smaller than what it's supposed to be, then that means your airway is gonna get smaller, and then it's gonna make everything harder when it comes to your breathing. Now, I actually made a detailed video on why people's jaws have been getting smaller, so I'm putting a link to that video in the description below, so make sure you check that out. But part of the reason has to do with us not breathing correctly. So if as we're growing up, we're breathing through our mouth and we're not breathing through our nose, and our mouth is always hanging open, then our jaws will grow in a more elongated and narrow shape because our cheeks are gonna keep everything constricted. Ideally, we should be breathing through our nose from an early age and onwards, because this will ensure that we keep our lips closed and also our tongue resting against the roof of our mouth. And ideally, our teeth should be slightly touching as well. These three things will make up proper oral posture, or perfect mouth posture. And when people grow up with this mouth posture as opposed to mouth breathing with their mouth hanging open, then their jaws tend to grow in a wider U shape because the tongue will encourage the palate to grow wider and forward, and then the rest of your jaw will follow. Now, the fourth dental problem you can get is erosion. Erosion on your teeth is basically when some acid is wearing away your teeth. And it can present in different ways, but basically it's wearing away the top layer of your teeth, or the enamel in your teeth. And certain parts of your teeth will look more yellow. And we also know that sleep apnea is associated with GERD. And when you have GERD, it means your stomach acid is gonna flow back up into your esophagus, and it can even get into your mouth. In turn, this will lower the pH in your mouth and make everything more acidic. and your enamel will wear away at a pH of 5.5. And we know your stomach acid is way more acidic than that. And this is what can help lead to dental erosion in a lot of cases. Now, if you combine that with grinding your teeth like we talked about before, your teeth are already weaker from these acids, and it's gonna help wear those teeth away even quicker. The fifth dental problem you get is periodontal disease. Now, we talked about how when people grow up as mouth breathers that it can narrow their jaw and make them have a lot more sleeping issues later on because they just can't breathe properly. Well, this mouth breathing will also dry away all the saliva in your mouth. And your saliva is basically a bodyguard for your teeth and your gums. And it's really important to have enough saliva because if you don't, then it's really hard to prevent getting gum disease. And this is unfortunately what happens when people have sleeping issues, because a lot of times when people have sleep apnea, it's because their mouths are open and then their tongues fall to the back of their throat and cut off their breathing. Not only will this ruin their sleep and also contribute to a lot of other diseases, this will also increase their risk of getting gum disease because it's drying away all the saliva. Now, this also brings us to the sixth dental problem you can get, which is cavities. And it's for the same reason that we just talked about. Because you're drying away that saliva, you're not gonna have that saliva protecting your teeth from those acids and from those bacteria, which will contribute to those cavities. Now, numbers 7 and 8 also tie in together, so I'm gonna do those together. Number 7 is having functional tooth wear or tooth fractures, and number 8 is abfractions. So functional tooth wear is a little bit different than grinding and clenching because when you grind your teeth, it presents as basically these divots in your front teeth and also the flattening of your back teeth where the anatomy of your teeth kind of gets flatter, whereas functional tooth wear is more uneven. Or if you fracture your tooth, it's just 1 or 2 teeth that completely break. Now, this can also tie in to your grinding and clenching your teeth because the more you use your teeth, the shorter the lifespan you get from them. If you look at our ancestors, you look at their skulls, you'll see that a lot of them had really wide, spacious jaws and all their teeth were in the right place, but their teeth were really worn down. It's because their diets were really hard foods and they ended up chewing their foods a lot more. So over time, it's normal for our teeth to wear down. But if we're constantly grinding our teeth and constantly biting the wrong way, like if we have malocclusion, kind of like we talked about before, or crooked teeth, then it's gonna wear our teeth even faster. And this again will bring us to number 8, which is abfractions. So an abfraction lesion kind of looks like a punched out lesion right by the gum line. And this one's always a little surprising for people, but the reason that this happens is because you're putting a lot of stress on the tooth where it's not supposed to be stressed out. So if you're putting excess stress on the top of the tooth, like again, when you're grinding or clenching your teeth, or if your bite is off, like if you have malocclusion and you're hitting on teeth the wrong way, like they're not supposed to be, then it can weaken that part right by the gum line because it's kind of like physics where if you keep bending a wire or something like that, that middle part is gonna get really stressed out and get weaker. It's the same thing with your teeth because that part of your tooth right by your gum line is the middle part of your tooth because half your tooth is still in the bone underneath your gums. So that middle part gets weaker and that's how you get that punched out lesion right by the gum line. And this can lead to sensitivity or it can just be an unpleasant sight because it looks really yellow, and especially if it happens to the front teeth. Now, number 9 is having impacted teeth. Now, just like how I said all these things are related, this is one of those. And an impacted tooth, you'll probably hear this a lot with wisdom teeth, is when there's not enough room for this tooth to come in. So sometimes as your wisdom teeth are coming in, your wisdom tooth can come in horizontally or it can just never fully erupt. And the reason is because there's just not enough room. But again, if you look at our ancestors, they didn't really have this problem. All of their teeth were straight and all of their wisdom teeth came in the right place. And you'll remember that they never really had orthodontists or any sort of dentistry back then. It all comes down to our jaws being smaller now. And I talked a little bit about that, about us being mouth breathers. But again, I went into detail on why that's happening in a different video, so make sure you check that out. Number 10, the last dental issue that's related to sleep problems is orthodontic or orthognathic relapse. So if you ever had braces or jaw surgery, there's a chance that that might relapse. For example, if you get braces and your teeth all become straight, and then you stop wearing your retainer for a while, your teeth are gonna start to shift again and get crowded again. Why does this happen? Well, because when you get orthodontics done, like braces or Invisalign, it's never really fixing the main problem. Yeah, you're pulling your teeth all in the right direction, but the musculature in your face is gonna be pushing these teeth in different directions again if you don't wear your retainer. For example, if your mouth is always open and you don't have good tongue posture and you don't have developed jaw muscles, then everything's gonna get more constricted. Your cheeks are gonna start to push everything in, your lips are gonna start to push everything in, your tongue isn't gonna be preventing those upper teeth from kind of coming inwards, and this over time can lead to those teeth narrowing again. And when they get narrower, there's no room for them, so they start getting crowded. This is why it's really important to wear your retainer after you're done with any braces or Invisalign. But this is also why it's important to have that proper oral posture, to have your tongue resting against the roof of your mouth. Not just the tip of your tongue, but also the middle part of your tongue. To have your lips closed and also your teeth slightly touching. All of this can help prevent this relapse. Now, I still think it's important to wear your retainer or listen to your orthodontist or oral surgeon if you get some jaw surgery done. Now, I know that that is a ton of issues that can come from or even contribute to a sleeping disorder. But luckily, there are some simple things you can start doing to improve your sleep and also prevent a lot of these dental issues. And the main thing this comes down to is encouraging breathing through your nose as much as possible. So throughout the day, just focus on nasal breathing, especially when you're relaxed or watching TV or something. If you catch yourself with your lips open, correct yourself. Try to get that proper oral mouth posture that we talked about and try to focus on just breathing through your nose. You can also try to focus on only chewing your food with your mouth closed and not with your mouth open. First of all, chewing your food with your mouth open is kind of gross, but also if you chew with your mouth closed, this will help enforce that proper oral posture because you're going to be developing those muscles in your face a lot more. And also, two key things you need to start doing when you're sleeping are number one, using a mouth tape, and number two, using a nasal dilator. Now, if you're able to properly breathe through your nose already, you don't really have to use that nasal dilator, but I would definitely give it a shot to see if it improves anything. The mouth tape that I like to use is something called 3M micropore paper tape. It's literally this medical grade tape that you rip off and you tape over your mouth. And the nasal dilator that I like is a Breathe Right strip. It's literally a piece of tape that you tape over your nose, or you can get an internal nasal dilator. Another brand I like is something called Mute, which is literally this clip that goes on the inside of your nose and you can crank it open on one side. A nasal dilator is also really good if you have like a nasal valve collapse, where when you're breathing through your nose, especially if you breathe really heavily, that your nose kind of pushes inwards and makes it harder to breathe properly. You might be surprised, but 50% of patients that simply tape their mouth shut and use a nasal dilator strip will resolve their dental issues that come from sleep apnea. So if you have a 50% chance of resolving a lot of these issues, like you grinding your teeth and having TMJ pain by simply taping your mouth shut and putting a piece of tape over your nose, I would definitely take it because it sounds way better than having to get a jaw surgery or a CPAP machine or something else like that. Because we also have a lot of studies coming out that show that when you encourage nasal breathing, whether it's using a nasal dilator spray at nighttime to clear up your nose or using a nasal dilator strip or using a mouth tape, that all of these will help resolve sleep apnea on its own. These are all very non-surgical, non-invasive, very simple things you can start doing at home to help improve your sleep and also improve the health of your mouth. So thank you guys for watching. I hope you liked that video. Try some of these tips out and let me know if they helped you. We have an epidemic right now. People are chronically tired. Sorry, what'd you say? According to a 2022 NHI survey, 13% of adults in the US reported feeling very tired or exhausted most of the time over a 3-month period. And this meta-analysis